So hi, I'm Hannah Savage. I'm a gynecologist and I will be discussing an STD known as HPV today. Most patients that I have seen with this disease are 17 through 30-year-old men and women. And in the last year, I've had 450 cases of HPV in my office alone. That's almost 2 people per day. It's quite a bit. As we know with this disease, it's transmitted through sexual intercourse, and it increases the risk of cervical and penile cancers. And patients who have contracted HPV may notice things like genital warts or itching in the genital area, but most people won't experience any symptoms at all. There is no cure for the virus, and if it doesn't clear up on its own, the treatment I recommend is loop electrosurgical excision procedure with freezing. This has had a really positive result in eliminating affected tissue. A particular patient of mine, she is 21 years old, she's female, she's African American, she's ranked socioeconomically in the lower middle class, and she has had cervical cancer in her family, so she'll come to see me. She's been seeing me once a year for the last 3 years for regular checkups, and so on her recent pap smear that we did, she had some abnormal cells, so I tested for HPV and it came back positive. That was a few months ago, and since then it's been just a waiting game to see if it, clears up on its own, as she doesn't have any symptoms that affect her daily routine. I asked her if she knew about HPV before she contracted it, and she told me that she had heard of it here and there but didn't know much about it. My patient is just one example of how uneducated the public is about HPV. As more and more young people are becoming sexually active early in life, we need to actively spread the word about this disease. A major problem that needs to change nationally is the abstinence-only sex education. We need to educate 13 to 18-year-olds in school about preventative measures. Instead, abstinence-only is not realistic anymore. We need to teach students about condoms, especially because they not only prevent pregnancy, but they also protect people from STDs and the transmission when performing sexual interactions. There also needs to be a seminar on the correct way to put on condoms and have students perform and then be checked for accuracy. Vaccines are another preventative measure given in adolescents to prevent this disease, and I believe that we should have pediatricians notify parents at young ages about the vaccine and highly recommend it. Even if one doesn't choose to go with a vaccine, such a small preventative thing like condoms can save people from the time spent in the doctor's office and some money spent as well. And that is all.